my life. So we're taping it and then we're uploading it onto the Instagram. So it's sort of live-ish.
All right.
All right, and here we go. Well, we're back here in this beautiful room that Infinite Strength gave us to use for our live interviews. And we're here with our longtime friend, Deltra James, who is here with us. We'll talk about this conference. But first, I really wanted to ask her, Deltra, how are you? What's going on in your life?
I'm doing pretty well. I mean, I'm very excited to be here today. I'm doing well. I'm not in any pain, so that's always a good day.
That's always a good day.
I just passed 2 years on Trodelvy, which is, an exciting treatment option to have as someone with a triple negative MBC. I'm doing really well on it, so I can't.
It's now approved for young positives as well.
I did hear that recently.
Right.
So that's awesome.
So, and how are you doing on that? I've heard that Trodelvy is a little less harsh than HER2, but I guess, it's hard to compare, but how are you doing on this particular? So, for those of you who don't know, Trodelvy is an antibody-drug conjugate. And if you want to hear more about it, you should check out our episodes. We've talked a lot about different options, and Trodelvy was first approved. It's an antibody-drug conjugate first approved for triple negative. And so how long have you been on it now?
A little over 2 years now.
That's pretty incredible.
Last month made 2 years, and I'm super grateful.
Yeah.
I haven't had very many issues with it. I've had to play around with dosing, which gave me an opportunity to advocate for myself. Just saying, I would like to stay on this drug, but I think I may have a better experience if we could change something up. So I really advocated to change up the frequency of treatments.
You'll have.
And my dosage as well as my pre-meds. So all of those things.
Basically,
And now it's been
so basically,
much better.
a patient cure thyself, right?
Yes. I say I'll take all responsibility.
So give us the lowdown on what is your protocol that you're on. How frequently do you get that?
So originally I was told that it would be given 2 weeks on, so I'd be going back-to-back weeks, and then 1 week off. But personally, I felt like that was really harsh on my body. And so now I'm every other week, and I feel like that pacing, having this spaced out like that, gives my body more of a chance to recover in between treatments. So.
And you have lowered the dose.
Yes.
Requested to lower the dose. And what are the pre-meds that are using for this?
So there's so many pre-meds, when they
Really?
roll out that little card, my nurses, and then just a ton, and I couldn't name them all. But personally, I know some people absolutely love the Benadryl and the Benadryl-induced, coma.
Not me.
I do not like feeling, really loopy. And personally, I made my treatment visits like me time. I have 5 children, so
Yes.
you find me time where you can. So I go to treatment by myself. I like it that way, and I would bring things to do. Maybe I'll bring my computer to get some work done. And that just wasn't happening on this treatment. It was frustrating for me because they would give me the Benadryl IV through an IV, which is, as you know, much more powerful
Much more
and
powerful.
instantaneous.
Yeah.
And so I would just start to go,
Right.
which I disliked. So I asked if we could try without that, and they allowed me to because they felt I had been on the drug long
Right,
enough
and you don't have
that
any
we
allergic
weren't
reactions.
so afraid about a reaction.
Right.
Yeah.
Right, me too. When I was on my first line of Taxotere and then Taxol, I did not enjoy Benadryl at all.
Yeah.
So like you, I've asked to go and
Yeah.
do the good.
Yeah, it made it rough. It kind of made me feel like I was just out for the count on those dates.
Right.
Like I couldn't do treatment and plan on doing anything else. So.
And it's nice to have the me time when you
It
can
is.
you can
Yeah.
enjoy.
Yeah.
Something
So I've
else.
not been dreading treatment as much.
so how does it work? So 2 weeks, 1 week on, 1 week off, right?
Yep.
And how many days
Every
do you, like bad days, a few days a week of that? And then-
Yeah, I'll say for me personally, the main side effects I experience is maybe for like the first 4 days after treatment, things will taste kind of off. So I'll live off of like V8s. I don't know if it's the case for everyone, but it's something that like tastes
that works
good
for
to
you.
me.
Yeah,
The
because
tomato,
it's
you know?
salty and
Yes,
tomato,
yeah.
yeah.
So that, and then I did have some issues with, experiencing stomach pain, which isn't uncommon with it, unfortunately, but it's been a lot better lately. So.
Wonderful. And how are the kids? We just heard that you had a 9th birthday.
Yes, yep, and I have an 11th birthday coming up next week. They are doing well. 4 of them are here today. Shout out to Camp Kism. Who's here providing
What a
childcare.
wonderful thing.
They are.
They're doing.
My girls love them. They've been going since the summer after I got diagnosed, and they just adore them. So it's been a good support for them because obviously everyone in the family is affected by cancer. So
Of course. And so your mother just let it slip that there's a new man in your life.
yes. Also shout out to my boos.
Well, we're very glad. We're very, very glad to hear that. And that talk on sex was probably very timely, I hope.
It was a good one.
It was
a very good one.
a really good
And
one.
as you could see, it's a conversation that isn't being had enough in doctors' offices.
No?
And MBC patients want to have those conversations.
But you know what the thing is, and that's what I was thinking about. So Dr. Splinsky is both gynecological and breast cancer oncologist. So most oncologists that you and I see are not gynecological.
Yeah.
So they would not have the knowledge of what she was talking about. So that's why it makes it so difficult for us. And in general, this is not a topic that you really would want to bring up with your oncologist. Oh, by the way, right.
Yeah.
So
I have though.
You have.
Because again, I went through a divorce after my
course,
diagnosis. And I remember one day just, doing the regular spiel with my doctor, and she just asked about all of the physical things going on in my life, with my body. And I'm like, I wanted to ask more about my mental and emotional well-being, and I don't expect her to ask about my sexual health, but I'm like, she could,
Yeah.
But I brought it up to her when I was starting to date, and she was just like, I don't really have an answer for you because I don't get asked these kind of questions a lot. Like most of her patients are, a lot older than me, and I guess it's not really conversations that they have. And so I have to look once again in my community, and events like this and lots of virtual support groups to kind of gather the information on my own.
Right, and here we actually got it all in one place.
Yes. Nice
So
thing
that
about
was
conferences.
wonderful. So for those of you, again, I said that before, for those of you who were not able to come to this conference, please think about it. Next year, it's free, and it's a wonderful, wonderful thing to go to. So tell me about Infinite Strength. So you've been involved with them for a very, very long time, and I know that when we did a Trailblazers episode on Roberta, and you spoke. So just tell us a little bit more about your involvement with this organization and what your takeaways are from today's conference, aside from let's talk about sex.
Yeah. So first, I'm doing a lot of shouting out today. So first,
That's right.
shout out
This
to our
is the
beloved,
place.
yes, beloved dearly Miss Lisa, because she connected me with Infinite Strength and with
She
Roberta.
did?
Yes.
I did not know
Yes,
that.
because as you know, she also lived in Connecticut.
She did
And
indeed.
she came to me during Breast Cancer Awareness Month a few years ago, and she said, hey, this really great organization is having a event for Metastatic Breast Cancer Awareness Day in the middle of Inktober. Are you available? They need someone, like another patient advocate. And that was my very first time speaking on a panel. And Lisa was right beside me. She could tell I was nervous, and no one could see it. She kept yelling. And encouraging me to speak more. And, But Infinite Strength is so special to me. There are so many wonderful organizations in the cancer community, but it's just near and dear to my heart because one, it's local to me. It's Connecticut based, and I'm Connecticut born and raised. But another reason it's so special is there's just few organizations I feel that help people out financially that I can put a face to, that feels so personal. I've said it before and I'll say it again, you know, there are so many organizations that are able to do grants, but it makes like, here's, you know, $500, go on your way and do what you can, you know? And they don't know me, they don't know my story, they don't know my children, I don't know them. But with Infinite Strength, it's just interchangeable when I'm saying Infinite Strength to say Roberta, you know, because I know her personally. She knows my story, she knows my children by name.
And she's interested.
Yeah, and she knows our unique needs. And there's just no organization like it. I think it's just lovely that she would decide, you know, as an early stager and someone in her position in life to, you know, reach out and help others who are in a totally different, you know, situation.
Exactly. It takes a special person to do this.
Yeah, it truly does. So it's just so special to be Infinite Strength.
So again, what are the main takeaways? Somebody just finished the morning session. So what are the main takeaways for you from this?
Main takeaways for me from this conference, I'll say, one, that it is so needed. There are many conferences related to cancer, but it's challenging to go into a space and if you feel kind of out of place because even though you're part of the community, you're in an advanced stage. And you know, it may be a mix of people and more geared towards early stagers and they're in survivorship mode, you know, not living with their cancer chronically. So I felt like it was really a needed space, you know, and I met some people today who was their first time being in a space with other people living with MBC. It was very different than connecting with people who are in survivorship. The other things I took away is just how much planning there is to do, and how much, again, I know that cancer is a family affair, but going to conferences like this and seeing work, you know, sessions that aren't only geared towards me as the patient, but towards my family and their care and caring for my children and my caregiver, making sure that she's taking care of herself, you know, and getting support. It's just very important.
I'm so glad. I'm so glad you said that, and I'm so glad we were able to come and meet so many people and to see you again.
Yes, it's good to see you.
Please come back. I mean, you're a fixture.
Yes, I'll come back anytime I'm invited. Anytime I'm invited, I'll come. I was like, I should do it. I was listening to some past episodes recently. I was like, oh, I'm in such a different place from when I first started dating to like being in a committed relationship.
So that is another topic we can do. I don't know if we have done that. Dating with MBC. So let's talk about it. All right. Well, good to see you. Thank you so much for coming.
No, thank you guys for coming and being here.
All right, nicely done.
How long did I take? A long time?
It was like 15 minutes, maybe?
Yeah, that was a little short interview.
It's not
That was
13
That's
minutes.
it. She was on the
Okay.
like it.
Yeah, nice.